All right. Hello, everybody. Thanks for joining. Just watching everybody come in. We're got about a minute left before 12:30, so we're just going to let everybody come on and then we'll get started. Oh, it's now 12:30. Let's go ahead and get started just for sake of time. Welcome in, everybody. My name's Clarissa, and we're going to be doing a deep dive today for our community forum over Maui Health Systems. So we're continuing our journey through. We highlighted Hilo, actually all of the HHSC East medical centers last time, and that was a really cool thing. This was actually brought up by one of our users to feature Maui Health System, so we're really excited today. We're going to do a brief welcome, and then we're going to go over some tips for viewing that data and kind of go through a workflow there with some screenshots. And the facilities we're going to be going over are going to be Maui Memorial Medical Center, including the outpatient clinic and wound care and hyperbaric therapy. We do have Kula Clinic. There is historic Kula hospital data. Right now they're temporarily closed, so continuing on, they do have outpatient clinic services, and that data is in the system, as well as the Lanai Community Hospital. And so we're really excited today to bring that up for you guys. We'll end today's session with the Q&A. As always, you can enter into the chat any questions you may have or any things you want to talk about at the end. And then we'll also have that Q&A at the end. So as I mentioned, let me just get to this next slide. As I mentioned, we're just going to do a brief introduction. My name's Clarissa. I'm the Director of Provider Services here with HHIE. My background is as a family nurse practitioner. I've been an NP for 8 years and have done family practice in pediatrics. As an RN, I did ER and med-surg. And then in my early days, I was a medical assistant and I served as a pharmacy technician while in college. So my role here at HHIE is to be the lead CHR and notify trainer, the two tools that we offer. And I love, kind of helping you guys, our users, to help troubleshoot issues or things you're seeing in the CHR. And I'm going to pass it over to my other half, Jackie.
Hey everybody, I'm Jackie. I'm the client relations specialist here on the provider services team. I also have a clinical background. I spent about 10 years as an acute care SLP, also with some SNF experience, primarily geriatrics. I work on the registration portal and do some CHR trainings as well. You may have seen me recently. If there is people needing to get access to CHR, I will help out with that. And with that, I'm going to pass it off to our newest member of our team, Kim.
Hi, I'm Kimberly Taylor. I am the newest member of the provider services team. And my background is labor and delivery and case management in nursing. I was a RN. So I bring that clinical experience. And my role here is client relations specialist, and I do the help desk. So if any of you have reached out to the help desk for help with password or navigation or any questions, you'll probably find me on the other end. So that's it.
All right, yeah, thank you. And we're excited because we are a full team of clinical staff, which we absolutely love, that we get to kind of be that end user support for you guys and helping you out. So let's get into today's session. So as mentioned, this is Maui Health Systems, and they share with us documents called Continuity of Care Documents, or CCDs. And for displaying that clinical data in the HHIE portal, in the community health record, when you are into, can you see my screen? I see some, I'm currently presenting. Okay. I think it's just speaking. So when you are into a patient's chart, to find that CCD data, we're going to start right off at the Documents tab. So if you are in a patient's chart, this is the view. We always use the left-hand side to navigate. We're going to go straight to that Documents tab to start that navigation. Once we come into the Documents tab, an area where a lot of people start kind of discouraging that use is they come into the Documents tab and they see this No Records to Display. And they're like, oh, there's nothing here. They're going to go on about their day. But what they're missing is we do have clinical data that is brought in through a query and retrieve function. And that is this piece here under Find External Documents. So Find External Documents is how we do that query. And that is for facilities like today, Maui Health Systems. This is also going to be HPH. This is how we pull in those VA records, including the Department of Defense records like Tripler Medical Center or any other of the military treatment facilities across the US. This is also how HHSC Kauai is sharing, as well as Kahuku Medical Center. So when we hit this Find External Documents button, it's actually going to do a pull of the patient. So it's going to say in progress, and it does take about 30 to 60 seconds to load. And it's going to pull up with all of your patient's demographics here. And all you have to do is select the checkbox indicating, yes, this is my patient. And then here we'll say Find Patient Documents. And so that is going to send a call out to all of those facilities. And it's going to say, hey, do you have any clinical data that matches this patient's demographics? And so once that action is done, it then returns and says, yep, I've got all of this data to return. And so it's very easy to kind of keep that checkbox. It already stays checked for you. And then you're just going to load those selected documents. Now, when it loads, it's going to now populate it to where in the Documents tab, you're going to see all of those visits. Keep in mind, this is doing a search out to not just Maui Health Systems. This is going to Hawaii Pacific Health and all of those other facilities that I mentioned. So when you pull in all of those documents, especially if you're looking specifically for Maui Health System data, it may not be on the first page because HPH tends to be first. I think it goes alphabetical order. And so it tends to be that first documents that you see. So you'll see all of these HPHs grouped together. And then you start the Kaiser Permanente documents. And so it may not be on the first page that you see data available for Maui Health Systems. As you can see in my screenshot, the Kaiser data did not even start to appear until page 10. And so don't be discouraged that it's not there. Now, there is another way you can only, if you're only looking for Maui Health System data, when it comes to this point, you can always deselect and only select the Maui, but once you deselect all, you have to go one by one to only select those documents. So that's totally your choice if you want to do that. But the easiest way is keep in mind, all of them will be grouped together. So here's all the HVHs and then all of the Kaiser, including Kaiser Permanente and Maui Health Systems are going to be grouped together. So once you navigate to whatever page that starts, you can see here we have this high-level continuity of care document. It is always the first document that you come across when you are dealing with Hawaii Pacific Health or Kaiser Permanente. And we're going to kind of cover that here. So there are a few different types of clinical notes that we receive, and these are just some of the most common. That high-level continuity of care document is basically just like a summary of care. The table of contents at the very front, I snapped a picture of one that had a table of contents there. This is just very high level. It kind of summarizes the high level things that the patients had experience with Kaiser Permanente facilities. And so you can see it's not visit specific, it's just total care specific. And so it's a good place to start if you're just trying to gauge like what type of history your patients had with a Kaiser related facility. But if you're looking for specific types of notes, you want to go into those individual notes. So these are some of the most common ones that I have found to be the most I see, and kind of going over what you may find in each one. So the office visit CCD. This one is going to be primary care visits. They may be specialty care visits. Maybe the patient's seeing a cardiologist or a rheumatologist, and you're looking for those type of notes. If the patient is receiving any type of outpatient treatment for speech therapy, occupational therapy, physical therapy, those notes are going to be in that office visit CCD as well. Someone brought up the other day looking for case management notes for outpatient case management. I do find those in the office visit CCDs, then those will be in there as well. For those patients who have been admitted to a hospital, those are going to be called hospital encounter CCDs. So if that patient's been admitted and you're following along with their care while they're in the hospital or after discharge, you need access to that discharge summary. It's going to be labeled as hospital encounter CCDs. Now, I do see that any type of outpatient diagnostic study, MRI, CT scans, even echoes, those are also labeled hospital encounters. So if you have a patient who's been to a Maui Health System facility and it's an MRI or a CT scan, look for that hospital encounter CCD as well, because that could be inside that note. I also see outpatient surgical procedures like colonoscopies or any type of outpatient procedure, orthopedic procedure, whatever that may be. As long as it's an outpatient procedure, it's going to be also labeled as hospital encounter CCD. And what I see for those is it will say hospital encounter, and then right above it or right below it will also be a surgery note. So you'll be able to see that that's probably what those are because they kind of group together. They're one right after the other. Emergency CCD, so these are emergency room visits. These are patients that have been admitted and discharged from the emergency room. If they're still in the ER, it will continuously update as you go out and come back in to refresh. You can kind of follow along with what's going on. And then once it's been a discharge from the ED, it'll be a full CCD of everything that happened during that emergency room stay. The two that I see that most people have issues with is telemedicine and telephone. There is a difference. So telemedicine are those telehealth appointments. So if the patient has an appointment with, let's say they're living in Maui and they need to refer for someone off island and it's going to be at a Kaiser Permanente facility here on Oahu, then they may do a telehealth appointment and that's going to be labeled as telemedicine. If the patient is just calling the practice to ask a question or the nurse is calling to, go over some test results, those are telephone CCDs. So there is a difference. Refill CCDs, these are medication requests. The patient's calling requesting a refill or the nurse is calling to say, hey, your refill has been submitted to the pharmacy. Either way, that's what a refill CCD is. And then the other two, orders only, these are just orders entered by the practice. This could be lab orders. This could be diagnostic study orders, referrals. I typically don't find super big value in those because I'd prefer to go to the office visit CCD to see why the referral or why the labs. But that's what's inside those. And then the MHS scan. So MHS scan is an unattached scan document. We do not get those attachments. So if you were to open one of those documents, you may see like there's nothing in there. So I typically bypass those as well. These are just some of the common ones. Sorry, go ahead.
Before you move on, there was a question about the medications for behavioral health treatments in the chat. The question was, will medication-assisted treatment be included or BH substance use treatment therapy? And I said that will depend on how the visit is written, but I would like you to expand. I said you could expand on that a little bit more.
Yeah. So we actually have a policy in place. It's called our CFR 42 Part 2. This relates to alcohol and drug treatment programs, as well as psychotherapy notes. So we do restrict that data out, and it's restricted from the hospitals themselves as well. So you will never find, you may see like a discharge summary. Let's say the patient's been inpatient and they are started on a medication. You will see those behavioral health medications in there, but you will not see drug and alcohol treatment program data ever in our system because it's protected health information. So it's on the benefit of the patient to restrict that information. If you ever need access to that type of therapy notes or for like treatment in that respect, like if it's like a methadone treatment or whatever that may be related to drug and alcohol, you would have to directly contact whatever facility that treatment was received. And it's, again, it's for the protection of the patient's health information. So hopefully that answered that question. Just kind of continuing on as we go through. So the types of clinical notes, these are just some of the most common ones. I actually have an example here of one that I was really cool to see. I was doing prep for this and I saw these outpatient dialysis CCDs. I was really impressed to see those because I thought, I get a lot of questions related to dialysis treatment, and we really would love to partner with some other, like the Liberty Renal Care, to get their data in the system. But this one is really cool. So this one was for outpatient dialysis, and it actually had, the patient was receiving care at Liberty for outpatient dialysis, but the orders for the dialysis were actually in the CCD document. So I was really impressed to see that. So check those out too if you're interested in dialysis care. But we're kind of going through a workflow of like, what would I look for if I'm looking for an emergency room CCD? So here's an example of how that populates. You see that emergency CCD. And again, that first high-level continuity of care document is always at the top, and that's your first document you come across for the beginning of the Kaiser Permanente health records. So once I go below that, I know that this is the most recent encounter the patient has had with a Kaiser related facility. And so if you are interested in a 7-day post emergency room visit follow-up, that emergency room visit is always going to be towards the top because it just happened. And so you're going to click into that. And then I took a little screenshot of that table of contents because that's very quick at the top of the document. And it's very great, like, ways to kind of see what's included in that CCD. But some of my favorite things to use are that Control F. So Control F gives you the ability to search through that document using like some headers that make sense. So ED course, this one's great. This goes over the overview of all the treatment that was received, what brought the patient in, what did they do for the patient, and what was that medical decision making that either led to the patient being admitted or discharged. And then the plan of treatment. Was there any recommended follow-ups that need to be made? Because usually emergency doesn't schedule appointments for you. So it may say, schedule appointment with your PCP within 5 to 7 days, or, you need to see an orthopedic doctor. Then that will be in there so that you as a care coordinator, you as the PCM can make sure those things are ready to go when the patient comes in for their hospital or their emergency room follow-up appointment. So if you just hit Control F and type in these headers, you'll get straight to that point in the document. And those are one of my favorite areas to search. So let's say that same patient, instead of getting discharged, they actually get admitted, right? So once the patient is admitted, that emergency room note actually goes away and it transforms into a hospital encounter CCD. So what happens is, because now they're admitted, it turns into a hospital encounter CCD, but that emergency room note is now inside that hospital encounter CCD. And it's like one big document of everything that happened during that entire stay. And so key searches here, encounter details, it's pretty close at the top, but this is like a template, and it's a really great place to start because it shows you exactly when was this patient admitted, the date and time. And if they're still in the hospital, it'll say dash and then present, meaning that they're still there. If they have been discharged, it'll say admission date and time, then the dash, and then discharge date and time. You do see the department where they were admitted to, who is the care team, who's the admitting hospitalist, and then what was their admission reason. So great place to start at the very top of the document. The next is ED notes. If you're looking for what happened during the ED stay, type that ED note in there. H&P notes, this is great for the history and physical. This is the attending, the admitting doctor, and you get that treatment plan. And then consult notes. This is medical and SDOH type of consult. So if that patient is receiving case management in the hospital, right? If there's some transportation needs, or maybe there's some housing needs, food needs, and so that patient's been consulted for a social worker or for a case manager, that's going to be under consult notes. So definitely look there. So some tips for this area that I found. So one of the biggest things is CCDs, especially those query and retrieves. Psychiatric consult notes also fall under that CFR 42 Part 2. Behavioral health notes related to like medication treatment adjustment, not alcohol and drug, but just in general behavioral health, they will be, but psychotherapy notes will never be included. So that's the one-on-one with the therapist.
Right, but this first, but it's like a psych consult to the ER. Shouldn't that show though? Because that's not a psychotherapy note. Yeah.
Correct. Yes.
And then
ER
Molokini unit stuff. That would show.
Sorry. Notes to
Just the Molokini unit, because that's not necessarily 42 CFR stuff. I mean, unless they have an independent track as a substance use treatment disorder
I would
program.
be really interested. I believe they should be, because it would still be under that hospital encounter CCD.
Right.
Through that. And I've not seen any restrictions to a specific unit, but if you have any specific patients that you'd like me to look through, I'm happy to do that too. That's kind of one of my favorite things, is being a detective there to do that. So I totally would love to look into that with you.
Okay. I don't have anything in mind right now, but if I do, I'll let you know. Thank you.
Thank you. Thank you.
Yeah.
So kind of like some big things here is that CCDs in this query and retrieve, they're not permanent data to us. We have requested to view it while you're in that patient's chart, but once you leave that chart, it's like it goes away. And so if you are in a chart and you are looking for a specific encounter, always hit that print option and download it as a PDF, because if you were to come back and need it 10 minutes later, it's gone. You have to go through back that query and retrieve process. But that's how new data is presented. So in order to pull it with the refresh most current data, that's how the system does it. So once you leave that chart and come back, you don't want to see data, whether it's hours, days, or weeks later. You don't want to see that data you saw from the first time you searched it. You want new data. You need to know what's going on now. And so that's why it forces you to do that again. So always do that. So let's say that patient's been discharged, right? The patient's now discharged. That hospital encounter CCD still remains the sole source of viewing everything that took place during that encounter. And those control F features that I mentioned before still are valid. If you need to know what happened during the ED, if you need to know what happened during the course, but these are 2 additional ones. So discharge summary is going to go over the official diagnosis, any procedures that happened during the stay, and the hospital course, which includes like medication titration, right? The other one is discharge instructions. Are there any appointments that are already made on behalf of the patient, as well as medications that are appointments that need to be made on behalf of the patient? And then medications. Are we starting any meds? Do we need to discontinue any meds? And so these are my 2 other ones that I typically like to search with. All right, and then outpatient follow-up. So let's say that patient now, they need to get back in with their PCM and you want to follow up, make sure they received that PCM follow-up. You're going to look for that office visit CCD. And I love that under the author, especially for our outpatient clinics, it actually labels them appropriately. So like I've seen Kula Clinic in there. You see the Maui Memorial Outpatient Clinic. It does a really great job of helping you determine who that author is. So key searches in these, encounter details, again, that's that top level template. Assessment and recommendations, that's plan of care. What are we doing for the patient now that they're outpatient to make sure they don't get readmitted? And then we've got plan of treatment. So is there any upcoming appointments that are already made? I actually really enjoyed, I was looking at a note the other day and the patient had a PICC line and was going to be receiving outpatient antibiotic therapy. And all of those appointments that were already made were in that note. So I really enjoyed looking at that too. So you can see any upcoming appointments that are already set up for the patient. So Kaiser Permanente in and of itself as a facility or as a health system, they don't share ADTs with us. So these are the admission, discharge, and transfer notifications. So any of the users here today, if you use Notify, you know that ADTs, we do not get them from Kaiser Permanente. But we actually have an independent connection, a different interface with Maui Health System. So we actually do get Maui Health System ADTs. And so that's great. So if your patient's going to a Maui Health System facility and you have Notify, you're going to get notified in real time when significant life events happen for your patient. But to access these just as a face sheet, you can actually come up here to the right-hand side to Profile and Face Sheets. My favorite tab is the face sheet tab. Demographics is great too, but face sheets is where I typically go right to. And each face sheet is their own face sheet. So these are all visit specific. Each one is its own visit. And it tells you exactly where they were seen. What type of admission was this? Was this an ambulatory visit, an outpatient visit? Was it an inpatient or an ER visit? You get that details related to admit date and time. So you can kind of see where your patient's been. And this isn't just ADTs from Maui. This is ADTs across any facility that shares them. So that's Queens and Castle and Hilo and Kona. We get all of those ADTs. So you're able to see those face sheets for all of those visits. And each face sheet is different because it's different for each visit, but they include so much data. And I'm just for sake of time, I'm not going to go over each one of those, but you can see just how valuable this data is inside of a face sheet, especially because each one, you're going to see those ICD-10 codes related to what happened during that visit, right? What is that visit about? Very quick, right off the bat, you can see that face sheet. So definitely take a look at those if you're not familiar with that tab. The other thing that we have is a connection with their labs. So Maui Health System labs are done through Clinical Labs of Hawaii. And so you can find them inside the CCDs. If you're in like let's say a patient's going to see an endocrinologist and they've ordered a whole bunch of labs because endocrinology loves to order labs, and they order a whole bunch of labs and you just want to see all of it as a whole, definitely go into that office visit CCD and search that Control F under results. And you'll see all of the labs that were ordered and done at the time of that appointment. However, let's say that same endocrinologist, right? You're like, you know what? I just need the TSH. I don't need everything else. I don't need all of the labs. I'm really just missing that TSH lab. You can easily come into the results tab. You can search here in the search text, TSH, and now the TSH will come up and the facility will show up as Clinical Labs of Hawaii, so that you're able to just pick out that specific lab. So if you're looking at labs as a whole, you want all of them, look under the CCDs and look under results. But if you're looking for a specific gap, if you're just trying to feel like, if you're a primary care and you're trying to find out what that A1C is for your diabetic patient, so you don't have to repeat it, come over to the results tab, come into the labs, type in A1C, and it will populate there. You don't have to go try to search through the CCDs to find it. So that's a really cool thing we have with them too. And so that's like a deep dive. These slides will be available. I tried to include as much as I could on the slides, so that way you guys have it if you ever want a resource to look back on. I'd love to turn it over for questions.
We did have a follow-up question from Charlene, and she said sometimes the hospitals do a behavioral health round on the patient during the hospital stay. Did you see if those would be included or not? Sometimes they're for capacity evaluations, et cetera.
Right, yeah, so those actually will, because at least for some of them, what I found is sometimes if it's a truly psychiatric admission and they don't have an admitting hospitalist who admits them, those can sometimes be a gap where I don't see them. But for the most part, if they've been admitted under a hospitalist and they're just being consulted for a behavioral health therapist, those are in the consults. So let me go back just so I can show you, Charlene. They would be under hospital encounter, CCDs. We'll get there. And you would do it. So once you enter in that hospital encounter CCD and you click it, it would be labeled under consult note. And it would be there as an external, as an inpatient consult to behavioral health. I think that answered the question. I see great, so I'm going to go with it. And as always, like one of the things too is, you know, as things kind of come up and are presented, these questions, if you guys ever need like some clarification or you're like, you know, I can't find this, I need help, please reach out. Like I said, it's my little private detective hat that I get to put on. And I really enjoy like getting to deep dive because you guys help me to help you to learn a little bit more. I always say I tend to learn more every time I'm doing this. These little deep dives are actually helping me learn too. So I really enjoy it. And so we want to thank you guys for your time. I don't think, was there any other questions, Jackie?
Not that I have seen in the chat. I've been answering.
Okay, cool. Well, I want to thank you.
There's one more. Yeah.
Malama Ikeola. So they shared with us in the past, and then they moved, I believe they're on Epic now, and it wasn't able to continue sharing. Honestly, it was before my time. And so Malama Ikeola historic data is in there. I need to get the date range, and I can definitely follow up with you to let you know. But we're hoping, I mean, that's a target for us. We're going to cover it a little bit more in future sessions with RHTP, the Rural Health Transformation Program. We are really hoping to expand our data sources to include like Maui Memorial Medical Group. We also want to do Malama Ikeola, Hana Health. We are really hoping that this expansion gives us the ability to onboard way more rural health clinics, as well as those who are in need for your community. So I'm excited for that. Hilo Benioff is in there. Please see Tammy. We did a deep dive in them last week, or in last month, sorry, not last week. So that one is going to be in our recorded sessions. And Jackie, I believe, can send you the link directly to you, Tammy. So you have that one to our deep dive in HBMC. And then Kuakini, we do get ADTs from them. So those are those admission, discharge, and transfer. So that's in that profile and face sheets. And they've been a great thing. We've been working with them really closely to get more data from them and coming soon. So excited to show that. As always, our contact information is here. If you need any training, if you want to do a training with me to, go over community health record in an hour session, I would love that. Please reach out to me to schedule. Jackie is also my backup. If I'm not available, she can do that. And then as well, if you need any help, if you're a point of contact and you need help with the registration portal, please reach out to Jackie. And then Kim is also there. Like I said, she runs our help desk. So if you need help with the password reset, you can always email the help desk, but you can also reach out to Kim as well. And we're really excited to do these. We'll see what next month. If you have a suggestion of a facility you'd like us to highlight, please send that to us, email us, or put it in the chat, and we'd love to highlight it. And yes, we do have notes from Kona Community Hospital. All right, we're at the top of the hour. Thanks everybody for joining us today. I hope you have a wonderful rest of your day, and we'll talk soon. Bye.
Thank you.
Bye.
Hi, thank you.
Thank you. Thank you.
Welcome. You're welcome, Daniel. Thank you.